Today I am reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran, philosophy part, and the chapter is 20, the homeopathic approach to diabetes. There are many diseases for which these days people recognize the severity of homeopathic treatment. Among such diseases are recurrent cold, asthma, skin disease, and rheumatic disorder, etc. However, there are some diseases for which most people think modern medicine is better. Diabetes is one such disease. In this chapter, I wish to share with you some facts about diabetes, where modern medicine stands and how homeopathy differs. I am using diabetes as an example to show the difference between the two systems in their approach and any pathology. The old ideas. If you ask an allopathic general practitioner what diabetes is, he will tell you that it is increased blood sugar and that it is caused by deficiency of insulin. He will explain that there is an organ called the pancreas which produces insulin. When we eat, various carbohydrates, sugar and starch are digested in the intestine and simplified into the glucose. This glucose is absorbed in the bloodstream and carried to various parts of the body. Glucose is fuel or energy for various organs and cells in our body. But for glucose to go from the bloodstream into the cells, insulin is essential. If there is not enough insulin, then glucose cannot enter the cell in proper amount. Thus, it remains in the blood and the blood glucose level rises. When the glucose level rises beyond 180 mg per dilution, the kidney are given instructions to throw out the excess sugar, and so we find sugar in urine also. The old idea was that diabetes is basically a disease of pancreas, that the primary problem is the deficiency of insulin and the treatment consists in controlling the blood sugar level. The normal blood sugar level range from 80 to 120 mg per dilution, and the prevailing idea is that the blood sugar must be tightly controlled. This control, according to general consensus, could be achieved by three means. 1. Diet. Diabetics are advised diet low in starch as a counterweight to the deficiency action of insulin. No rice, no potatoes and no sugar. Number 2. Pills. When diet fails to control blood sugar level, diabetics are put on oral anti-diabetic drugs. These oral hypoglycemic pills are meant to reduce the blood sugar. And number 3 is insulin. When even the tablet fails, directly supply of insulin through injection is advisable and is supposed to bring about good control. Now the under label change in viewpoint. As explained, it was commonly believed that diabetes is due to the lack of insulin. This was the idea until the time when the emerged certain method of finding out exactly how much insulin there is in the blood. When these methods were discovered, radio immunoassays was done, it was found to great surprise of the investigator that in the majority of diabetics, the amount of insulin in the blood was normal and even sometimes more than normal. Therefore, diabetes could be classified into the two types. Number 1, in which the insulin is lacking, type 1 diabetes or juvenile diabetes, which usually occur at the age of at the young age, and number 2 where the insulin was normal, and type 2 diabetes. It's called type 2 diabetes and maturity onset type of diabetes, which begins usually after the age of 32 or so on. Regarding the maturity onset diabetes, since no deficiency of insulin is found in most of the cases, it was suggested that probably there is a defect in the insulin receiving power of the tissues, that the number of insulin receptor is less, and this is still a speculation. Now under the label, a very significant discovery. I'm reading. The first things any doctor advises on seeing a diabetic is tight control of blood sugar. He will say, if you don't control the sugar level, you will develop a complication. The only acute complication of high blood sugar is coma. See what Harrison mentioned. Maturity onset diabetes develop not ketoacidosis coma but hyperosmolar coma, which develops at a blood sugar reading of 1000 to 1600 mg per dilution. Thus, coma is very rare in the adult who has developed diabetes. It is the juvenile diabetes who can develop a coma. When the insulin intake falls short of the requirement, even in this case, the incidence of death due to the coma is only 1% if treated correctly. So, diabetologists are not so worried about the coma. The worry is about chronic complication of diabetes. These are changes in the eye, means retinopathy, changes in the kidney, means nephropathy, changes in the nerve, means neuropathy, and the changes in the heart, ischemic heart disease. The basic cause of this complication is change in the blood vessels which occur in the diabetes. This is called microangiopathy and can be assessed by measuring the thickness of the capillary basement membrane. It was presumed that these changes occur because of high blood sugar. Therefore, it was thought that by controlling the sugar level, these changes would not occur. However, certain significant discoveries were made that upset this idea. The first was made by a renowned diabetologist named Sebastian. Sebastian found that these changes of microangiopathy occurred even before the blood sugar actually developed. He measured the capillary basement membrane thickness of potential diabetic. Example, those people who are very likely to develop increased blood sugar after the age of 35 to 40. When he measured this basement membrane thickness long before they developed this increased blood sugar, he found that it was already thickened. Now, under the label, the significance of the discovery. Sebastian's discovery meant that the microangiopathy, which was until now considered to be a complication of blood sugar, occurred long before the increase in the blood sugar. Sebastian speculated that perhaps microangiopathy is fundamental trouble in diabetic and high blood sugar level itself is a complication of the microangiopathy. The question, which comes first, microangiopathy or sugar, is like asking which comes first, the chicken or the eggs. This question is hotly debated in the diabetic circle of the world today. Example are complications like retinopathy, neuropathy, heart diseases, high blood sugar or not. Other scientists started finding evidence that the blood sugar control may not be related to these changes. For instance, knowledge found that found that in large number of juvenile diabetes, the complication occurring in the controlled diabetes on one hand and the uncontrolled diabetes on other hand were the same. Again, it was found that in certain races the complications are more or less similar, though blood sugar may fluctuate. Also, in the diabetic twins, complications are almost the same, though their blood sugar may be totally different. This means that these complications are probably inherited separately along with the blood sugar, and that they are not depend on much upon the control of blood sugar. It is generally acknowledged that these changes in diabetic to develop despite tight control of the blood sugar. The best that the diabetologist can say is that controlling the sugar probably slow down the rate of these changes, but even this is not very certain. Let us consider the different form of treatment now in a work for reduction of the blood sugar and control diabetes. The first is diet control. Under diet, previous doctors used to advise a typical diabetic diet low in starch. The moment high blood sugar is detected, doctor would immediately advise no rice, no potatoes and no sugar. Now they found that those diabetes on this typical diet have the highest rate of heart diseases in the world, whereas African and Asian diabetics who have never seen a dietitian or physicians in their life seems to have little incidence of coronary heart diseases. This means that the diet which is given to reduce sugar in order to prevent heart disease cause heart disease. That is why now a very high starch diet has been recommended and found to be most successful in preventing the heart disease. It has been found that in majority of onset diabetes, reduction of weight cures diabetes. Therefore, in obese diabetic, one must be strict in diet. In diet, it is necessary to cut the total number of calories. Second is diabetic pills. The next method of controlling blood sugar is the use of oral hypoglycemic agent. These diabetic pills were subjected to clinical trial in America, the University Group Diabetic Program, which involves medical department of leading American universities. They put 205 patients on the placebo and 205 patients on the pills for a 8 years period. To their surprise, they found that among those taking the pills, heart attacks were 3 times more frequently than among those taking a placebo. They had said that the blood sugar must be controlled, otherwise it will lead to heart attacks, and they found that very pills which control the sugars cause heart attack. It is likely to say that the diabetic pills control the sugar but kills the patient. The UGDP recommended that at least some varieties of the pills be banned. Most authorized today do not recommend the pills but use them only as a last resort if diet fails and insulin therapy is not possible. Number 3. Is insulin the final answer? Let us go now to the most dramatic treatment of diabetes. Example, insulin therapy. In the body, insulin is manufactured by the pancreas, where the sugar level in blood increase. As after meals, insulin is also secreted more. Thus, the hypoglycemia or low sugar and hyperglycemia means high sugar are prevented. At present, in insulin therapy of diabetes, such an adjustment is impossible. Therefore, there are likely to be period of hyperglycemia and hypoglycemia. Hypoglycemia can cause permanent neurological damage. Among other effects, it can also cause coma and death. Besides this, it can cause a Somogy effect which leads to more severe hyperglycemia. It is a matter of diabetic whether high blood sugar means below the coma level can cause complications. But it is certain that the low sugar is very dangerous. Therefore, fewer and fewer physicians now insist on tight control of blood sugar. Now we use human insulin. There are some impurity in the insulin available today, which can have their own side effect. Zinc, which used in insulin preparation, can, as homeopaths know, cause its own symptomatology. Hyperinsulinemia, means insulin level in the blood is high, is known to cause vascular changes, and it is suspected that at least some of the vascular complications in diabetic could be due to the insulin therapy. Now, under the label, what is diabetes? Is diabetes increased blood sugar or it is a vascular changes? Which is the cause and which is the effect? What is the cause of diabetes? Is it inherited? Is it due to the lack of insulin? What should the diet be? Are diabetic pills to be loaded or banned? In insulin therapy, as dramatic as it was made out to be, there are the problem diabetologists face today. No wonder the Jocelyn and Pioneer among the diabetologists confess that really we cannot answer the question, what is diabetes? In order to understand this question, let us look at the few facts. In the Pima Indian race of the United States, diabetes is common but heart attacks are rare. In the same country, 75% of diabetic die due to the heart attack. Natal Indian and Black South African have similar diet with respect to proportion of the carbohydrate, proteins and fat, but vascular complications are rare in the South Africa with the diabetes, while they are common in Indian. Thus, we can see that the diabetes of the Pima Indian is different from that of the American and that of the Black South African. Diabetes is not one disease, but it is a difference in different patients. Even in the ultimate stage of diabetic coma, we can find that one diabetic is different from the other in response to the therapy. Now, under label the limitations of allopathic treatment. The authority on diabetes now realize that the insulin level is normal in many maturity onset diabetes. They speculate that there may be some lack of insulin receiving apparatus, but they have not found any way to correct this. They found that the diabetes pills are doing more harm than the good, so they switch over on insulin. But they find that this cannot give perfect control and that insulin has its own side effect too. Finally, after too much struggle, when they managed to control the sugar, they found that all the chronic changes of diabetes are taking place despite the control. And now under the label, the homeopathic approach. Kant, the master homeopath, said a century ago what modern medicine claimed to have discovered recently. He said the person who said diabetes disease is insane in medicine talk of species of diabetes. In homeopathy, we do not fall into the trap of arguing what is diabetes, the sugar or the vascular changes. We say both are part of the diabetic process. Each patient has a specific constitution. By this, we mean that each person has a specific individual body, mind and disease. That is why different people get diabetes at different time, of different severity, with different complication and with varying the difference response to the same treatment. In homeopathy, we try to find a medicine to suit the mental disposition, the physical attributes, as well as the various complications of the patient. That is why homeopathic will select a different remedy for different patient with diabetes. For the homeopathic, diabetes is not the thing to be treated, it is the man suffering from it. Recent findings in the modern medicine emphasize the psychosomatic factor in the diabetes. It has been repeatedly verified that the stress is a primary contributor to the diabetes process. If stress is removed, there is a significant improvement. Stress, as well as homeopath know, comes from our false perceptions of reality, that is what we call disease. Each diabetes has its own individual disease state that is aggravating his diabetes. Besides other things, the homeopath aims to identify the disease state and treat it with a similar remedy. When the disease state is removed, the diabetes loses its grip like a creeper without a stick.